Good afternoon, everyone. My name is Vernell DeWitty, and I am the Chief Diversity and Inclusion Officer with the American Association of Colleges of Nursing. It is an absolute delight for us to be with you this afternoon to share with you an understanding of the most trusted profession and an exploration of opportunities within nursing. Two of my colleagues will join me in this presentation this afternoon, Stephanie Worth and Autumn Springs. Let me begin by sharing with you a little bit about the nursing profession and what we will discuss with you this afternoon. First, we will talk about the profession and pathways into nursing, and you would be surprised that there's more than one way that you can become a nurse. We will talk about the diversity in the nursing workforce. You will learn about resources and the application process. And then you will hear from someone who was a participant in the Summer Health Professional Education Program. And I'm sure that will delight you. And then we'll have plenty of time for you to ask your questions, and we can answer them. So to get us started, in 2020, the World Health Organization designated 2020 as the year of the nurse and midwife. I am sure that no one expected that 2020 would indeed be the year of the nurse as we encountered the pandemic. And I'm sure you all saw nurses providing care for critically ill patients, holding the hands of patients as they said their last goodbye to their family members. So 2020 was truly the year of the nurse, and in ways that we did not imagine at the time. The annual Gallup survey has named nursing as the highest trusted profession for the 18th year in a row. Nurses are viewed as having high ethical and honesty standards by 85% of the public who responded to the survey. Today, there are nearly 4 million nurses, and according to the Bureau of Labor Statistics, the median pay for a nurse entering the profession is $73,000. Nurses are often the most frequent line of contact for people of all backgrounds and experiences. The decade ahead will be one filled with challenges, new and complex ways of practicing, as nurses continue to live and work at the intersection of health, education, and communities in a wide variety of settings. A report was released by the National Academy of Sciences, Engineering, and Medicine in the early part of this year. And this was the second report that had been released discussing the future of nursing. And some of the recommendations from this report indicated that the nursing workforce should address the social determinants of health and health equity in a more comprehensively manner. That we should strive to promote the health and well-being of nurses, especially as they take on the role of health equity. Third, we should protect the nursing workforce during the response to public emergencies and public health disasters. And one of the fourth recommendations was that we should enable nurses to practice to the full extent of their education and training by removing barriers that prevent them from addressing the social determinants of health and by improving health care and access to care for all people. So you might wonder, why nursing? Well, I've already given you one reason, and that is nursing is the most trusted profession. Now we have approximately almost 4 million nurses. Nurses rarely have any difficulty finding a job. They are able to specialize in an area that is of interest to them while having high earning ability, and they are highly employable. And nurses work in a variety of settings. Most nurses work in hospitals, but they can work in outpatient settings, in schools, in public health settings, in hospice care. There are many, many variety of settings where nurses can work. And most of all, nurses give back to their communities, and nurses are remembered by their patients. Now, there are some unique things about the nursing profession. I mentioned one, which is that there are many pathways by which you can become a nurse. The second is that in nursing, we do not have a single centralized application process as exists for many of the other health professions. Another third unique aspect of nursing is that there's a lot of variation between the times when a student is officially declared a nursing student. And this is what I mean by that. Sometimes a student may apply to go to a college and indicate that they wish to major in nursing. They are admitted, but there are some preliminary or prerequisite courses that they must take and pass. Usually they must pass them at a certain GPA, and then they are considered a nursing student. In other schools of nursing, if you apply, you directly go into the School of Nursing. So there's variation from school to school. And as we indicated, there being no central one application process, there is no single admission examination for all admission students. Some schools of nursing use what's called a TEAS test. Some use a HESI test. So that you might want to consider when you're thinking about schools that you might want to apply to, learn what tests they use, if any, in terms of making a decision about your admission. Now, I'll say a little bit about what the enrollment looks like in schools of nursing, particularly as it addresses diversity. When we look at the US population that is becoming increasingly more and more diverse, we don't see the same degree of diversity in schools of nursing. It's getting better, but there's still need to improve. When we look on the left-hand side of this graph, you will see diversity in graduate programs, and that refers to persons who are earning the BSN degree in nursing. And on the right-hand side, you look at diversity in master level programs. So we see that, and this is data from the fall of 2020, last year. Diversity in undergraduate programs, 62% white, 12.4% Black or African American, 13.7% Hispanic, 7.7% Asian, very few Native Americans, less than 1%. The same thing for Native Hawaiian Pacific Islanders. So that you see the percentage diversity is not that great. The same for the master level programs. You see that the white enrollment was 62.9%. The Black African American enrollment was 15.3%. So you see that African Americans seem to be earning or going to school to earn master degrees at a higher rate than they are earning the BSN degree. And you see for the Hispanic population, the enrollment was 10.1%. So we are trying very hard to increase the diversity of the nursing workforce, because we know that patients really do like to see care providers who look like them. It helps them in terms of their connection and their communication. We also know that students who are enrolled in schools of nursing like to have faculty members who once again look like them. Now, Florence Nightingale shaped the nursing profession, and she was one of the most famous nurses, and she was British, and she did a lot in terms of saving the lives of soldiers, and she changed the way that nurses were educated and how the nursing profession was viewed. However, African Americans in the United States and around the world were not allowed to attend schools of nursing, and it wasn't until 1879 that the first nurse of color graduated from a professional nursing school. So we have experienced discrimination. However, we're working very hard to overcome some of this discrimination and address some of the racism that has occurred in our profession. So you might be wondering or thinking about, can I be a nurse? Well, some things to consider. Are you good in science? Do you like to help people? Are you taking classes in English, math, chemistry, biology? In order to be considered for admission into a school of nursing, these are the classes that you must take in high school so that you are prepared for college admission. Do you like to study hard? And believe me, nursing school is no cakewalk. You must be prepared to put in the hours and to do the hard study. You will have to bypass some of the social experiences that your friends have. You'll be able to not attend all the parties that everybody hosts because you have so much work to do. So just be prepared. Nursing is a practicing profession. It is a rewarding profession, providing you with unlimited opportunities and career pathways. When I was in nursing school, I never thought I would have had the opportunity to do all the things that I've done, to be a clinical nurse specialist, to be the director of a hospital, to work for associations. The opportunities are almost limitless in a nursing career. However, you must be able to enter the gates. You must meet the requirements that are going to allow you to become a part of the learning environment. And what are those skills? What are the skills that you learn and that you want to refine? First, thinking critically, good communication skills, intellectual ability, compassion. You must be detail oriented. You're taking care of people. What you do, the decisions you make, how you deliver the care, they really are matters of life and death. So it must be detailed oriented and have high emotional intelligence and stability. You encounter people at points in their lives when they are most vulnerable. They're sick. They're looking to you for help and guidance. You must be organized. And yes, you must have physical stamina. Working long hour shifts, taking care of many patients does require a certain degree of physical stamina. Now, the next question, what steps do I have to take to become a nurse? First of all, you must complete an accredited nursing program so that as you're looking at where you might want to attend school, you must always make sure that the program is an accredited program. And once you graduate from that program, you must take and pass the licensing examination. You can graduate from college, but if you can't pass the NCLEX examination, you can't practice nursing. And it's when you pass the NCLEX exam that you will then obtain a license to practice. And there's a license for each state where you want to practice. Some states have what's called a compact, which means that you can live in one state but practice in multiple states. Um, Once you're employed as a registered nurse, you really want to begin to think about additional career training and education for yourself. Now, I mentioned that there are pathways for nursing, and here are some of the different degrees that you can earn. First of all, associate degree. An associate degree person can attend a community college, graduate from that community college, take the NCLEX, and practice nursing. The second route, of course, is to go to college or university, where you would earn the BSN and go through the same steps of taking the exam and then advancing. Another degree in nursing is the master degree. And then finally, the terminal degrees in nursing are the doctorate degrees. And in nursing, you might earn a DNP, which is a practice doctorate, or a PhD, or a doctor in nursing science. There are not many schools that offer the doctorate in nursing science anymore. Most programs offer the DA or the PhD. So this diagram tells you the pathway. You earn either a diploma, you get, there are very, very few diploma schools, and I might add, these are the schools where students went to school at a hospital and you earned a diploma. It was not a degree. But you can still do that. There are a few of those programs that are still around. Most of them have been phased out. You can earn the associate degree, the BSN. They all lead through taking the NCLEX. You pass it, you get a license, you go to work. Once you have completed that, you want to think about advancing your career. So you might decide you want to earn a master in nursing, or you might want to go into a program and you want to earn the DNP, the PhD, or you want to become a CRNA or a nurse specialist. There are lots of different pathways that you can take. It all depends upon what it is that you are interested in doing and where you want your career to go. How much do nurses earn? This is just an example. And it depends upon where you are, where you live, and what the salary scale is. So you see that nurses really do have substantial earning capacity wherever it is that you are. After you become a nurse, we talked about continuing education, earning advanced degrees, and then getting certified. If you are in a certain specialty, my specialty was maternal newborn nursing. So I did a certification in maternal newborn nursing, and I also earned my master's in maternal newborn nursing before I went back to school to earn my PhD. Now, there are some differences between the PhD and the Doctor of Practice, and these are some of those differences. First of all, the DNP is a focus on nursing practice. Some of these individuals enter into independent practice where they have their own practice and they see patients, they're nurse practitioners. There is These are the requirements that you must meet. There's usually a capstone project. You do not do a dissertation. The PhD, the focus is usually nurse researching or faculty positions. You can focus on any clinical area where you might wish. There is a requirement for a dissertation, and most PhD prepared nurses are either nursing faculty or nursing research positions or some other area of practice. Now, as I conclude, there really is a need for nursing. The demand is going to increase, and we have been told that we will have a shortage of nurses in the not too distant future. We need more nurses in behavioral and mental health. We need nurses because they will be able to increase, hopefully, access to primary health care. We need nurses who can help address high maternal mortality rates, especially for women of color. And we need nurses who are able to address health disparities and inequities. A nation cannot fully thrive until everyone, no matter who they are or where they live, how much money they have, until they are able to live their healthiest life possible. And helping people to live their healthiest life is always and will always be essential to the role of nurses. We play a critical role in achieving the goal of equity. And now I will turn the presentation over to my colleague, Autumn Springs. Autumn, take it away.
Thanks, Vernell. I will go ahead and share my screen. Just give me 1 second, everyone. Apologies. Little technical difficulties here. 1 second.
Well, as we wait, I did notice that we did have a couple questions. Do we want to handle those now right before? I think you're on mute, Dr. DeWitty.
Yes, sure. If Autumn, are you ready? Or I can take the questions, Tony. That would be fine while Autumn gets ready with her presentation.
Sure.
Okay.
So I'll go to this question. What can you do with an MSN?
Great question. With an MSN, you are able to work, for example, as a clinical nurse specialist in a hospital or in an outpatient setting. You are able to work in a hospital as a what's called a clinical nurse leader. Many persons who work in healthcare settings in managerial or administrative levels are prepared at the master level. We also have many nursing faculty members who hold the MSN degree. So there are lots of opportunities where you can practice, you can teach, or you can serve as an administrator or a high-level manager with the master's degree. When I had a master's degree, I was a director for maternal newborn services. I later became the director for a pediatric rehab hospital. So there are lots of things that you can do with a master's degree. Okay, I think Autumn is ready, so I'm going to be quiet and let Autumn take it away.
Yes, just let me know. Are you seeing the presentation screen, everyone? Yes, okay, awesome. Hi, everyone. Apologies about that. So my name is Autumn Spriggs, and I'm Student Services Manager for AACN. And I'm very happy to be joining you all today along with my colleagues. And my portion will be brief, but I did want to highlight just a few resources that are available to you as you consider obtaining your nursing degree. So as Dr. DeWitty discussed, when it comes to an education and career nursing, there are many different degree types and many different pathways that you can take. So if you're considering an education in nursing, it will be helpful for you to understand the differences between the degrees and what you need to do to obtain each degree. And Dr. Dwitty did a great job of explaining briefly about that. So you will hear more about Nursingcast in a moment from Stephanie Worth, but Nursingcast is an excellent resource that compares the different nursing degrees. So they have listed the degree types, the description of each degree, and whether or not it is an undergraduate degree or a graduate degree. And then once you have an idea about what program you want to pursue, you can visit our website at AACN and utilize our program directory. With this, you can look up a specific school to see what programs they offer, or you can search for schools by program. So if you know you want to get an MSN, you can look for schools that have the MSN or offer an MSN degree. Or if you know you want to go into more a higher level of practice, you can search for schools that offer a DMP. Or if you have PhD, et cetera, you can look that way. Another resource that may be useful to you for an introduction into nursing is the Johnson & Johnson nursing site. They have a lot of in-depth information here, from basic information again on the different degree types if you want more information on that, or you can look at specific information such as the nursing specialties. So if you want to know what you can do with an MSN, you can go here and look at their nursing specialties portion of their website. So I recommend visiting that page. They have over 90 listed, and they provide information on what each career does, what the average annual salary is, what the degree requirements are, if it's patient-facing or research-oriented, and what jobs are in high demand right now. Also have a list of nursing scholarships that they offer, and an ongoing podcast where you can hear from nurses in the field and nursing leaders. So if you decide to apply to nursing school and seek financial aid assistance, AACN has a great scholarships and financial aid page. We offer specific scholarships for undergraduate and graduate students. Some scholarships provide multiple awards throughout the year, which is a great benefit for students, so you're able to apply more than once. We also list scholarship and financial aid information from outside organizations. So if you don't see something that you may be eligible for from AACN, you can look and see if there's other scholarship that applies to you. And lastly, another great resource for financial aid is the HRSA National Health Service Corps. They have a scholarship program for students in health profession fields, including nursing. So scholars who receive this award commit to provide primary healthcare services in health professional shortage areas for a minimum of 2 years. So that's just a brief overview of some of the resources that we have. Now I'm going to turn it over to Stephanie, who can cover a more important tool and resource when applying for nursing schools. And I'm just going to ask Tony to stop sharing my screen because I don't have my controls anymore.
Great, thanks, Autumn. Let me go ahead and pull up my slides here. Okay, so we'll go ahead and get started. So as mentioned, my name is Stephanie Worth, and I am the Director of Strategic Partnerships at AACN. I'm not going to turn my video on right now because I was having some difficulty with my internet connection earlier, so apologies, but let's go with it. So as Autumn has mentioned, and Dr. Dwitty, my role at AACN is to oversee a service that we call Nursingcast, and it's our centralized application service. So I'll talk to you about that in a little bit. But really where my focus has been for the last 15 to 20 years is in helping healthcare students prepare and strengthen their application. So my goal of these slides here today is to talk you through how to work through a timeline to best put together an application so that you can be competitive for the programs that you want to apply to. So one of the main things I'll stress is that you can't apply to nursing school overnight. It takes time and you need to organize. And one of the things you can start doing well ahead of time, even now, several years out, is to review and start selecting programs that might be of interest to you. It's important to see what the deadlines of these programs are so that you can start working back in your timeline to determine when you need to take certain courses, take certain tests, complete experiences, things of that sort. So by selecting those programs, looking at the deadlines, we begin to work the timeline backwards. When you're reviewing those programs, you want to make sure and know what their requirements are. And Dr. DeWitty mentioned earlier, different programs are going to have different requirements. Many of them are going to have specific prerequisite courses that are going to heavily involve science. And naturally, you always want to focus on your GPA and keep it as strong as possible. Now, a 4.0 is not required, but programs do want to see that you will be successful in their coursework. Some programs might require letters of reference. Some might require experiences. Is that shadowing, volunteering, or work experience? Licenses and certifications might be required by some programs. And as mentioned earlier, are there standardized tests that are required? Perhaps the TEAS or the GRE or the HES. And some programs might require a personal statement as well. You want to be preparing for a well-rounded application. Many of our nursing schools use a holistic review, so you certainly want to have a well-rounded application, but above all, focus on that GPA, do the best that you can, apply early, and put your hat in the ring. So one of the things that you can look at when choosing the right program is the mission of a program. You might say a program is dedicated to serving rural areas or urban areas. That might be of specific interest to you. Certainly look at where the program is located, but I would encourage you to cast your net broadly geographically when looking at programs. Some programs might be more competitive than others just because they're in an urban popular location. So cast that net more broadly if a program is close to you. Right now, it's certainly important to look at the delivery method of the program. Are they online? Are they on campus? Certainly look if you're interested in pursuing research. What research opportunities does a school have? Do they have certain programs or a clinical focus that might be of special interest to you? And to help you pick the right program, certainly try to attend open houses or recruitment events. Many of those are virtual right now, but certainly some still in person as well. And a few slides here, I'll show you how you can find where many of those are listed in a common location. So, as I mentioned, Nursingcast is the centralized application service for about 290 schools. Now, keep in mind, there are almost 1,000 nursing schools across the country. So this certainly isn't all of them, but it's a good resource for you to use to start researching programs out there. It allows you to submit one application and apply to many programs similar to the Common App that you might have used in high school. Now, where it becomes beneficial to you right now as you're searching for programs and researching programs is that you can set up a free account. You don't have to pay anything just to search around. And you can use the filtering options to say, show me all of the schools in a certain state, perhaps Mississippi, that offer a BSN through an online method. And the system will list programs in front of you. And you can quickly click through their pages and see what the requirements are, their deadlines are, and start building out that game plan that you need to begin working on. So this is a really cool to help you look at almost 300 colleges, all kind of in one place. So you see the URLs listed here, but certainly you can always just Google Nursingcast and it will take you directly to the site. And once again, that is free to set up an account and shop around. So tips for, whoops, let me go back one slide. So tips thinking about writing your personal statement. I always tell students that it's never too early to start working on an early draft. You always want to be working on that content. So keep in mind as you're pursuing some shadowing opportunities, work experiences, volunteer experiencing, I would be keeping a journal and jotting down key notes about those experiences. What day? How many hours? What did you like? What did you not like? What do you need to research further? What questions did you have? And then move to the next one. This is going to be really helpful in a year or two from now when you're ready to write that essay and you have all of these experiences quickly jotted down to kind of remind you of what you thought about those particular experiences. While you're in Nursingcast, you can even go ahead and look at print essays that are listed, essay prompts or personal statement prompts that might be listed by a program. They might change next year, but they're all going to be pretty similar typically. And you see some of those examples listed here. So certainly you could start an outline now and begin thinking about how you would answer these questions. When it comes time to actually put together that first draft, I would highly recommend that you utilize your Career Center or Writing Center on your campus. They're both resources that are free to students that you pay for using your tuition, so take advantage of them. The value of a professional review is that the advisors within a Career Center or a Writing Center have reviewed thousands of essays for this exact purpose, experts in this field. Also likely have a pre-health advisor on your campus. You should seek them out. They might even be located in your College of Nursing. While you can certainly have your friends and family review your personal statement, don't rely upon them for heavy feedback. They are probably not experts and they have probably not reviewed thousands of persons, and they are naturally going to think you are wonderful. So use those professional resources. Another idea is to consider having your references review your final draft. This serves two purposes. One, you get another professional review, but two, then your reference can have a little insight into your passion for the profession and why you're pursuing it. Your ultimate goal is to show your experience and interest in a unique manner. So not just I want to help people, but why nursing and what have you done to learn that it's right for you? So these letters of recommendation, once again, you're not just going to make those relationships and get these letters overnight. It's going to take planning ahead, knowing what types of letters programs might require. Do they want a letter from a professor, or from someone who works in a clinical setting or a professional setting? Keep in touch with those references. If it's someone that you had a class with previously, keep them updated as to what's going on in your world. Certainly allow them days, 1 month to submit that letter. The last thing you want to do is rush them. And be strategic as well. Keep in mind that you can encourage your references to include certain comments. You can remind them, remember that time that I led this class project and I did X, Y, and Z. I'd really like for you to highlight my leadership skills or my project management, whatever it might be that you're seeking to balance out in your application. So now with the experiences, they can be challenging to obtain in this time of COVID, but be persistent and know that colleges are being flexible in the experiences that they allow right now during the admissions process. So to get ideas for shadowing or connections, certainly feel free to reach out to your pre-nursing advisors, nursing schools, once again, those pre-health advisors, campus, and the Career Center. When you're volunteering, you might look on your campus for student healthcare organizations that have coordinated efforts. And keep in mind, as I mentioned, schools are being flexible. So some have recently told me that, students are not getting face-to-face volunteering experience, but perhaps it's working with nursing homes to speak with elderly patients, or perhaps it's delivering groceries to those who can't get out right now. So be flexible and try to do as much as you can to learn about others and learn the nursing profession. So one of the big things I want to make sure you're aware of is next week, we are holding a Discover Nursing virtual fair. We're having over 100 colleges of nursing who will be participating in the event, where you can log in, it's free, and you can go into the chat rooms and speak with nurses and faculty, admissions representatives, current nursing students. You do have to register, and I've dropped that link into the chat box. So make sure and copy that and go ahead and register. And you can even mark which schools you think you're going to visit during the virtual fair if you want to know which ones are of interest to you. But definitely recommend that as an easy one-stop shop to chat with some programs. Even if you're not going to apply to them, you might ask them, how do you recommend I get shadowing? What would you like to see in my experiences? What would make me competitive? They're more than willing and happy to help. So the last thing I want to point out is, as I had mentioned, we have recruitment events going on all over the country all the time. And if you visit this Nursingcast school events page, I have the link listed there on the bottom. Once again, you can see all of the upcoming events that are taking place. I took a little screenshot here of the ones that are even taking place next week. And you see they're all over the country, from Michigan and Cal State, Rush, Natty, Oregon. So lots of opportunities for you to attend these sessions and learn more about programs. So at this time, I'm going to turn it back over to Autumn, and we'll do some Q&A with a ambassador of your.
If my university doesn't offer a BSN, so I am majoring in physiology, in health and disease, what would a possible pathway toward nursing look like?
Okay, if your School of Nursing does not offer a BS, so they must not have a nursing school. So they don't offer a BSN degree is what I'm assuming. So what you might do is you might look around for nursing schools that have what are called accelerated programs. And accelerated programs are designed for people who have earned a non-nursing degree but want to be a nurse. And you can usually complete your nursing component in 12 to 18 months and then be ready to go ahead and write your NCLEX examination. If you're going to take that route, my recommendation would be to look for a program that has what is called a direct master entry program. It's going to take you maybe about 18 to 24 months, but when you complete that program, you will have, of course, been licensed and you will already hold the master's degree, which to me is a better advancement. So, and there are lots of programs who do offer those accelerated programs in nursing for non-nurses.
Talking about accelerated programs, can you talk more about the non-traditional nursing pathways and accelerated BSN or entry to master's nursing?
Usually the programs are designed for people who have a non-nursing degree. A lot of people come into that program with a related discipline, like in the sciences, but it doesn't mean that, let's say, if you have a degree in the arts, that you cannot come in. But what you have to do is to complete all of the prerequisites for nursing, and that would include things, courses such as pathophysiology, chemistry, microbiology. Um, some schools might even consider pharmacology a prerequisite. It depends upon the school. But if you would just look for accelerated programs in nursing, and there are many, many programs all across the country that offer accelerated programs. And oftentimes, it's not unusual for students to try that approach because there's so many people who want to get into nursing school. And if they're not able to get into the nursing program, sometimes they'll choose an alternate route, get a related degree, and then apply to an accelerated program because it seems that those programs have an easier entry. So if that's what you want to do, I recommend that you would give it a try.
How would the process or pathway be different if someone graduated from a college that doesn't have a nursing major?
Well, it would be the same thing because you don't have any schools in nursing. While you're in that college, my recommendation would be that you look at all of the prerequisites for a nursing school and see what they require and make sure that while you are in study earning your undergrad degree that you try to complete as many of those courses as you can so that when you are admitted into a nursing program you have already fulfilled most of your prerequisites. So look for what the entry courses are, try to take them where you are and get the best grades that you can.
Once you become a registered nurse, how does the process look like when switching specialties? And the example they give is switching from pediatrics to oncology.
Well, really, usually that depends upon where you're employed. And when you're working either maybe in an outpatient setting or in a hospital, um, you can usually make the switch. And usually the employer makes the determination if they want you to have some additional experiences. But usually, if you start out and you want to switch from one specialty to the other, sometimes the hospital might offer some some in-service programs that you can take and just start reading about and learning all that you can. And, and if you know someone who works in that space where you want to move into, see if you can have some shadowing experiences. Because then that would demonstrate your interest in the field and your willingness to take on the new learning so that you become knowledgeable and skilled in that particular specialty.
Is it possible for a nurse to have both a PhD and a DMP? Have you run across that?
Sure, absolutely. And we're seeing that more and more. Sometimes nurses will, when they enter the profession, they might decide to do the practice doctorate. The practice doctorate requires less time to complete. It also doesn't require you to write a dissertation. So oftentimes nurses will earn the DNP as an advanced practice nurse, and maybe they decide, oh, I'm really wanting to get involved with more teaching and maybe more research. And then they go and earn the PhD. And there are some schools of nursing that are now bringing online a dual degree program where you can earn both. And Autumn, I saw you nodding like you might want to add something to that.
Oh, I was just thinking of, I know a few people who actually have gotten the dual PhD DNP degree, and I've worked closely with them. So yes, it is possible, and many people do it.
Thank you for that. So when does a student determine their specialty? Is it while earning a BSN or an MSN?
Usually, when you're in your undergraduate degree, because you get introduced to all of the different clinical areas in undergrad program, you have to, because of course on the NCLEX you are tested on a wide breadth of knowledge. And most most persons when they're in nursing school will decide an area of practice that really appeals to them. And so when they graduate, they usually seek employment in that particular area, and just to see whether or not it's a good fit. And it's not uncommon that you might start off in one area and then you decide, I really prefer this kind of a specialty. This seems to work better for me. So and that's one of the great things about nursing. It's like you're not stuck because you make one decision today. So you work in that space, you see if you like it, and then if you don't, then you shift and make a change. And you can do that. Generally speaking, however, once you move into the space of earning the master's degree, you usually have made some decisions about what really appeals to you, because then you really want to deepen your knowledge base. You want to deepen your understanding of that specific area, because then when you start to work in that space, and then if you decide to go on, then you have more knowledge, more practice. For example, if you're going to go into a PhD program, you may have identified something you want to study, a topic for your dissertation. Or if you're going to go into a DNP program, you might know some of the areas of interest where you want to look at developing your capstone project. So it's generally when you get to the master level, you're starting to really narrow where your space of interest might be.
Perfect. Since there's such a demand in nursing, will there ever be a time in the future where there will not be enough jobs?
I've been in this space for a long time, and that's never happened. We go through these cycles where forecasters will say, oh, we're going to have an overabundance of nurses by, let's say, 10 years down the road. And when we get to year 5, they make the decision, oops, we made a mistake. So I can never see that happening. One of the things I think that constrains us is that, first of all, we don't have enough spaces in schools of nursing to really prepare all the people who want to go in. getting into a nursing school is very competitive. And we collect statistics at AACN, and every year there are upwards of 40,000 people who have applied, who are qualified, that don't get a chance to be admitted because we don't have the capacity in the school, we don't have enough faculty. So I don't really see that happening. And when you look at what's happening to the shift in our population, more and more people are getting older, and the more people age, the more health care that they need. Now, it's not going to all be this in hospital settings, but there are going to be many, many more outpatient settings and other care situations where nursing skills are going to be needed. I can't ever see a time when that happens. And right now, there are lots of nurses that are in my age group that are starting to retire because it's their time. So we're having a lot of people leave the profession, and at the same time, the increasing need for more healthcare service.
So could you go over some of the different types of certificates someone can gain as a nurse?
Oh gosh, there are so many. It depends upon what you want. Um, Most of the certificates in nursing are driven by the specialty. So for every specialty, there is a certificate that you can earn. The American Nurses Credentialing Center, and you can find them on the web, is the body for our profession that awards most of the certificates in nursing, and they are in every and all specialty.
And I'll close this out with our last question. What's the last piece of advice you want to give those listening tonight on our call?
That's a good question. Last piece of advice. The first is that nursing is absolutely an amazing profession to go into. And once you decide that that's what you want to do, make the commitment that you're going to work hard, that you're going to stick with it, and that you're going to complete it. So just start with the end goal in mind and don't stop.
Perfect. Well, I want to take the time to thank each of our presenters tonight. Each of you were amazing. And honestly, I think I speak for the audience in saying that I've learned so much. As a reminder to the audience, our webinars are recorded and posted within a week of the live session. So please follow us on our YouTube channel if you haven't done so already. And have a great evening, everyone.
Thank you. It was a pleasure to join you this afternoon.
Have a good night.
Okay, bye-bye.